Welcome, everybody, and thanks so much for coming and participating in this panel discussion that you will hear. I first want to just say Happy Nurses Day, Nurses Week, Nurses Month to our panelists, as well as all of our Chamberlain faculty. And Chamberlain, as you know, is the largest nursing school in the country and the largest BSN program with approximately 12,000 students in 15 states and 23 campuses. And because of that, it's important that we as faculty, as nurse educators, understand what experience has been in your practice this past year during the global pandemic. And we need to take that information that we hear from the six of you today and reflect on how we need to change or adjust nursing education based on your experience. And so now I'd like to welcome our six panelists, and each of them are going to just take a minute and introduce themselves. But as you know, they're posted in the chat, so you can see them there. We're going to talk for about 40 minutes and leave 20 minutes for questions, either live or from the chat. So with that, I will ask our group to introduce themselves. Let's start with Taryn.
Hi, my name is Taryn Pontius. I am currently working at the Johns Hopkins Hospital in Baltimore, Maryland. I graduated from the University of Pittsburgh, their main campus, in 2016. I've been working this past year as a travel nurse in COVID at 5 different locations. I've been a nurse for about 4.5 years with 3.5 as a travel nurse.
Great, thanks, Nicole. Thanks, Taryn. Now, Nicole.
Hi, my name is Nicole Welling. I am currently working as a travel nurse at Johns Hopkins Hospital in Baltimore, Maryland. I've been a travel nurse for about 3 years now. I graduated from the University of New England in Portland, Maine in 2016, and I've been a nurse for about 4.5, almost 5 years.
All right, thanks, Nicole. And Benithra.
Hi, my name is Bernitra. I currently work at the William Bremen Jewish Home, and I graduated from Chamberlain University, the Atlanta campus, in 2020. So I'm a new nurse, only a few months old.
Great, thank you. Cody.
Hi, my name is Cody Haywood, and I currently work as a registered nurse at Ridgeview Institute in Smyrna. I graduated from Chamberlain University Atlanta campus in 2020, so I'm also a new nurse and got to experience being educated in the pandemic.
Great, thank you. Morgan?
Hi, my name's Morgan Jones. I'm working currently at the MLK Community Hospital in Los Angeles giving vaccines. I've been a nurse for almost 5 years, traveling for 3 of those. And I graduated from the University of Alabama at Birmingham in 2016.
Great, thank you. And Bonnie.
Hi, my name is Bonnie Metzger. I graduated last year. It sounds like Benitra and I were in the same cohort. Graduated in April of 2020. We actually had 12 hours of clinical left when they shut down the hospitals. So we all kind of had that eek moment. I currently work for the Northern California healthcare system for the veterans at the VA at Mather, and have been a nurse. I've been a working nurse since September of 2020. It was a little bit of a task to get a job, even part-time. So, but I absolutely love what I'm doing now. I'm a care manager in the allergy immunology clinic. That's what I was hired in for as an intermittent to take the seat for the current RN. She's on leave. And then as of last week, I am full-time now, and I'm straddling between managing the allergy immunology clinic and doing the MSU. So.
Great. Well, we have a variety of backgrounds, different schools, different roles. So I'm excited to hear from each of you. But the first question I want to ask is, can you give us what it was like, a day in the life of a nurse working on a busy COVID unit? Because I think we all think we know what that was like, and we've heard parts of stories, but it'd be great to hear from someone who has experienced that. Let's start with Morgan.
So Taryn and Nicole and I, we all were working up in New Jersey for the pandemic. Really, I think we started in April. And basically a day in our life was we'd come in, we'd get reports. We would do our absolute best to put eyes on all of our patients before we started our day. We would try to look up everybody, do our best to figure out what was going on with them. And then you would start to see your patients. We would have 6 patients at a time on a med-surg floor. All of them were either on BiPAP, non-rebreather, high flow nasal cannula. Usually you don't see those on med-surg floors. And so we would start with the first patient. We would try to figure out what was going on with them. If they were declining, we would need to fix it. And then we would move to the second patient. And we just kept going down the hall doing that. And by the time we would get to the end of the hall and had seen all of our patients, it would be almost noon and we'd have to start over. So it's very different than regular nursing, and like, I guess this is regular nursing now, but what we're used to, trying to round hourly, trying to, I don't know, just put eyes on people. It was so impossible to do because everybody was declining so quickly. And it was really hard to get in contact with doctors because everybody was calling them about all of their patients who were declining. So
those physicians were probably in the ICUs and or doing what you were doing, just going from room to room, trying to see the sickest patients first. But I'm sure that was probably a lonely feeling. Either Taryn or Nicole, can you just talk about what the impact of not having family being able to visit, what that was like?
Do you want to take this, Jeremy?
Doesn't matter.
I think the hardest part of it is managing how many calls we got in a day. Really trying to ground in that we need one person of contact. When we had up to 7 patients when it was the hottest in New Jersey, and we were right outside of New York. So, you know, when we saw New York going down, we were also in New Jersey right next to it. And these patients, their families think that, you know, the worst outcome is happening. They want details, you know, so having that one person to go to is really important, but also managing the emotions of the patients and the families. You know, wives, mothers, they all want to talk to their family or get updates all the time. But it was also difficult when we had our patients changing in status. Do we have time to contact the family? When we finally do talk to the family, they're upset that they didn't know something happened sooner. So it was a lot of time management, trying to focus on our patients, but also taking care of the families as well. So it was really difficult. I think, you know, on top of having extremely sick patients, managing the family's emotions and their updates, it was very time consuming.
And it was also hard because, like, at the beginning, family wasn't allowed in even when they were dying. So yeah, I remember one time I was helping FaceTime a family to say goodbye, but I had to literally prop the iPad up so that they could talk to the patient and run into another room because I had somebody else going downhill. Like, I couldn't be the support person that I wanted to be in that time. That was very hard.
And being there in that vulnerable moment, like while a family member is saying, you know, their last goodbyes, it's really chilling to even think about, but to put yourself in that position, you know, it sticks with you for a really long time.
I'm sure. And then 2 minutes later, you have to go down the hall to take care of somebody who's sick. And so you don't have time to even process it, really.
No.
It's one of the things I think people didn't really appreciate, that families are really a safety net for nurses, are the safety net for patients, but families are the safety net for nurses. And to be able to at least, you know, get somebody a drink or get somebody's attention when they need them, you know, just somebody to be there so they're feel attended to a little bit more when you're so stretched. One of the other things I wanted to just talk about is what, if anything, your education did to prepare you for this experience, and what are things that we might be able to do different or you needed to understand more of. because we know this is not going to be the last pandemic for another 100 years. We've seen smaller epidemics, but if all of you get through your career without another global pandemic, I would be surprised. So just here, sorry to say that, but just really want to hear how your education prepared you or what we could have done different. Cody, let's start with you.
Being a recent graduate, in school, it's really harped upon therapeutic communication, and we're like, I want to learn real nursing stuff. But at the end of the day, therapeutic communication and that being such an important focus in school really has made nursing in the pandemic, especially at a psychiatric hospital and rehab facility, has really made all the difference. The other staff that I work with are always truly amazed by my ability to communicate with the patients and the families and make them feel comfort in when they don't have their family around. I mostly work with the adolescents in the psychiatric. So they are away from their parents and their siblings and friends for the first time. And I believe that therapeutic communication helps me a lot to kind of shine and excel in that aspect and make the patients feel more comfortable in an uncomfortable and unfamiliar situation. And I think that that is really important for the faculty to continue to teach, especially in these times where the families and patients aren't together all the time.
Yeah, one of my mentors says that knowledge is power, relationships are the key.
Yes, absolutely.
How important that is. Anybody else want to add to that about your education, things that we should do more of, things that you felt really prepared for that made a difference?
We kind of had a little discussion before this, and I think something that stuck with me, being in 5 different locations all over the East Coast, was my community class. It was very heavy on poverty levels, income levels. So we saw a lot of people waiting to come in, lower income class individuals waiting to come in because of like health insurance issues or stuff like that. So it was nice to be put in a situation during school where it was heavily focused on lower poverty. So we had that communication, and understanding, like, why didn't you come in sooner? Well, they have their reasons, do they have health insurance? Are they waiting till they legitimately can't breathe anymore to come in because they can't afford it? So community, to me, a lot of people I know brush it off, but seeing the different levels of care given to different income levels, it was really eye-opening this year. People just didn't come in when they needed to because they were scared.
That's a great perspective. And one of the things that we're trying to do at Chamberlain is really address throughout our curriculum the health disparities that are prevalent in our country, and how can nurses be advocates for people, not just patients, but for the broader groups of society, wherever you are, whether it's at a board meeting, at a PTA meeting, at a church or a synagogue, wherever you happen to be, that you can advocate for evidence-based practices that make a difference. And community is really the capstone, I think, to making that happen. Also, next week, on the 11th, the Future of Nursing 2020-2030 report's coming out. The National Academy of Medicine and Robert Wood Johnson have been working on it. And it's going to talk about what is the role of nurses in eliminating health disparities. And I think all of us are just kind of excited, waiting to see what the recommendations are and how we as educators can make a difference in enacting those recommendations. Anybody else, anything that you think we could do better of, more of, different in education?
Coming from a student that graduated in the pandemic and trying to get jobs, I actually reached out to about 10 of my cohort and kind of had conversations with them on their thoughts, because I didn't want this to be just my voice in this. But I think kind of the overall thing was just really instilling in students that they have to reach beyond what we get at the university. They need to be encouraged to step out. I mean, we're so overwhelmed in school and just trying to get through what we need to get through. I totally agree with what they said about community health. I think that we short played that, you know, and looking back, I mean, so much of what we learned that we thought was going to be insignificant in our early career ended up on the forefront. Getting the nursing students to get involved in those nursing organizations as quickly as possible, to get really comfortable, to build those relationships, those professional relationships. What we saw in coming out of school, beside the fact that you're a new nurse and a new grad and you have that label, was that the hospital stopped hiring outside. There was basically a hiring freeze in California because all the elective stuff went by the wayside. So all the elective healthcare teams then went into, you know, the needed areas. And so that obviously isn't at fault of the university, but those students that did get jobs, it was because they had relationships with those people outside the university. And I think that's a lot. I know a lot of the students that, you know, I was with, I think that they missed that. We still have, I kind of, you know, reaching out, talking to people, there's still a handful of us that are just now getting full-time jobs. It's been exactly a year since we graduated. And then there's some that still are not working as nurses. And so I think, you know, motivating them and being involved in like CNSA and things like that presented those, but I think a lot of the students don't get that value when they're in school because they're so tunnel visioned on getting the curriculum completed. So I mean, what we did in the university as that graduating cohort, that was great. We ended up doing a final project on telehealth because the way that clinical stopped, that was for me going into the clinic setting. That's almost like 80% of that world during April, May, June, and July. A lot of the students or a lot of the medical specialties and the nurses, that's what we relied on. And that it just kind of changed my assessment, you know, of the patients being that virtual and knowing how to change or make that decision of whether or not that patient really needs to come in or if we can keep them outside the clinic.
I think that's a good point. And telehealth really is a skill. You don't, you know, pop on a computer and just know how to do it. You really do need some experience doing it. So that's very helpful. And during this period of time, the professional organizations have been a lifeline to a lot of nurses, particularly those in acute and critical care. AACN and ANA and others have really tried to keep people up on what's happening because, you know, it was so new that people were trying one thing and it didn't work and then they had to try something else. And the other thing that I'd be interested in is there a difference how you do nursing care when you're on an acute care unit with COVID patients? Is there a difference in how you approach that when you don't have enough resources, when you have limited resources compared to what you usually have? Be interested in hearing about that.
So when we were in New Jersey, we actually had an issue with finding enough pulse ox machines, which was very difficult with this COVID being mainly respiratory illness. So, I mean, we had to run around trying to find them. Usually they're attached to the vitals machines, but at this particular hospital, they weren't. And they were using just the little portable ones, but they would get lost. People would accidentally keep them in their pocket, take them home. We ended up, actually all three of us, we ordered some online. it was so almost impossible to even find them. We ended up getting them from a website. Maybe not the most reliable pulse ox, but we would before each shift, we would check it on ourselves, make sure it like seemed like it was going to be correct, and then take it with us and hope that it worked at the hospital.
Yeah.
Nurses are resourceful. Benitra, did you have anything to say related to that in your environment? In terms of how you work when you have less resources than you were accustomed to? And Benitra, you're on mute. Anybody else have anything you want to say about low resourced environments and how you work in that setting?
I think definitely like people got very creative. I remember one hospital we were at, they didn't have continuous pulse ox monitors attached to their tally boxes. So they actually would hook up monitors in the room that sat on the bedside, and they would have baby monitors. They would have them in the hallway pointing in on them so that you just walk down the hallway and you can see any of your patient's oxygens.
Oh, that's awesome.
Great. Cody? Cody, did you have anything to add?
Oh, no, I was saying that's awesome. That's very creative and innovative. And that's one thing going to school in the pandemic taught me is, as a nurse, not only do you have to predict and foresee things, you have to expect the unexpected and be prepared for that. And I know at Chamberlain Atlanta, it may have been really difficult for the faculty to adjust, but they made it seem so like they just did it. And it was just amazing to see them do that. Like as a student, I felt like they didn't skip a beat. You know, they really got it together quickly. And as a nurse, that taught me a lesson that you just have to be prepared to make it happen and be creative. And whenever you have to work with what you have, and that is what we as nurses do. And I learned that from that experience being educated during the pandemic. So it's good to see that happening, because that's a reflection of that ability we hold as nurses.
So I think there's a problem with my speaker. Okay, so one of the things that you highlight is, and I'm sure the faculty on the line from campuses really appreciate what you just said, as well as our online faculty, but a lot of work went into keeping that going. And I think one of the things that everybody recognized is, while we weren't on the front lines, we were preparing people, and we didn't want to slow down because we knew they were needed there. And so that's, you know, we always talk about faculty are role models. And if they role model caring, if they role model innovation, if they role model intellectual curiosity, that passes on to the students. So I really appreciate you sharing that.
Yes.
Anybody else on that before I move to the next question?
I just wanted to share on the note of faculty, you know, being there for us. I know being on the cusp of graduation, I know something in California, there was kind of this wall at first, then ended up just being a hurdle. But I know the administration and the faculty, they really advocated for us as student nurses. We were able, again, that telehealth program, we were able to do that to actually complete our clinicals. And I know a lot of nursing students that were at the universities and the junior colleges that they had to repeat those semesters because their administration wasn't able to make it happen for them. And so I was just very, very grateful for that and for their energy and their perseverance in making that happen for us.
Yeah. Thanks for saying that, Bonnie, because it's very stressful on faculty who are used to teaching in person. It's a very different, as you have experienced, it's very different being teaching online. And so for you to share that and you know, how much you appreciated that, I think can go a long way with our faculty, just hearing that and the preparation. And they're still doing it today. And hopefully not much longer. As soon as we can safely get back to campuses, we
Yeah.
certainly will.
And just to add one more thing that was like a really special experience for me, when I did my critical care clinical online, the professor, she was actively working on a COVID unit ICU. And she literally would bring reports from what she was doing on her shifts and make it case studies for us. So that was like totally awesome and current way of like getting what's going on currently. Of course, she would keep all their personal information private, but as far as like what was going on in the ICU with the COVID patients, and that was like really amazing. And it was like current evidence-based as they were learning it, like as they were like trying this to treat patients and trying that. And then she'd come back the next week when we had clinical again and tell us how that worked or what they stopped doing or what new things they were doing. And that was like a really special experience too, getting to know that going into my career.
We do have a high proportion of students who, faculty who are clinically involved or aren't that far removed from clinical. And I think that being able to tell those stories really puts things together when you're trying to learn something as complicated as nursing. Another thing that people have talked about a lot is about the emotional health and well-being of nurses during COVID, especially when they were taking care of patients with COVID or having to deal with the COVID restrictions. And I'd be interested in hearing your thoughts about that and what we might need to do going forward. Benithra, did you want to answer that? I think we may have lost her. Who would like to answer that question? Take a stab at it. Just about emotional and mental health needs of nurses that have experienced this past year.
I think for me and what surprised me the most in watching the nurses, I was just not so much surprised, but just really in all the different situations that I worked in, just in awe of the resiliency of the nurses. I worked in a post-acute, which is with chronic ventilator patients, and watching the nurses, the ratios there were much higher, and we just elbowed together. It was very team oriented. Every place I've worked, it's about leaning on each other and give and take and doing, because a lot, with a lot of those particular patients, you had to have multiple hands. With the nurses, I mean, obviously you guys were out there traveling, you're exhausted, you're absolutely exhausted, and you just, you feel like you can't do one more day. And then you find that little nugget, that little, encouragement by the patient or that patient's family that's on the phone or outside the window thanking you, for being there. And I saw that. Something that was hard for me was at times you would see that paralyzing fear in the nurses as well as in the patients at totally different polarities, where the nurses are scared to death that they're going to take it home to their family. And so either they quit working as nurses and they go work as a checker at the market. So we're losing part of our team, or they leave their family and they're living, in an apartment away from their family themselves, taking care of patients that don't have family. So losing their safety net. So that's really what I saw, and that was how the fear would overtake us as nurses, but then also seeing it in our patients, and how in our patients, sometimes it would suspend them or keep them from getting the care that they needed. If they weren't in the hospital being cared for by, the acute care nurses, they were frozen at home when they should have been seeking professional help, because then they ended up in the emergency department because they waited too long.
Mm-hmm.
So
thanks, Bonnie. Anybody else want to talk about the emotional or mental health issues for nurses that have really come to the forefront this past year?
I definitely feel I mean, I keep hearing about different nurses that are experiencing PTSD and all of that from watching all of their patients die. I don't know if I would necessarily say I have PTSD, but I definitely still, when I think about patients that I've taken care of and like what I've had to do for them and finding out that they've died anyway, it's really, really hard. The first 2 weeks in New Jersey, I think I cried every single night. Luckily, though, I had Taryn and Nicole with me. We didn't really have to worry about bringing it home to family. We weren't able to really see our family, but we were all kind of in the hospital, obviously working and all at the same risk of contracting it and giving it to each other, which actually happened when we were working in Nashville together. We all ended up getting COVID, but yeah, I think it was just very, very hard. I don't know.
Well, especially being a newer nurse and not having experienced that, but even nurses who've been in practice for many years, it really, I think, has taken a toll. And one of the things that those of you who travel, be interesting to know what you thought was a supportive environment, a supportive work environment, even in the face of not having enough staff, not enough PPE. What you probably saw organizations that managed better than others, and I'd be interested in what that looks like.
We got to see everything. Honestly, we got to see really well prepared facilities. I think, it just popped in my mind just now. One of the things that New Jersey did for us and the hospital and the patients is it just actually came up in one of my memories the other day. Is anytime a patient was taken off a ventilator or a COVID patient got discharged, they played a song over all of the loudspeakers. So it was just, for one moment, everything was just kind of frozen and you're like, okay, there's like another success story. I mean, it's obviously like most of the time it was shadowed by something bad happening after, but for that one frozen minute, we just danced. We had parties, we had like tiny little dance parties, there were celebrations. We would like cheer people off the floor. So, and it was really nice because when you walked into the facility, they had their numbers, like these are how many vent patients came off. So seeing that number go up every day was just like a little bit of, motivation that we needed to, okay, we're making a difference. We're doing something. It's hard, but we're seeing success. So dancing to, and whenever we hear the song now, it's just like, we thought we would get sick of it, but there's so much positivity behind it.
Yeah.
Sure. Benithra, do you want to talk about in your work environment, how things have been and what some of the challenges have been? You're on mute.
Hi, I'm sorry. I am currently at work now. But
okay.
yeah, so it's been a challenge. I started work March, and I'm here. I work on the rehab floor, but it's also the quarantine floor. So all of our new admissions come here, on the 5th floor where I work, to quarantine for 14 days. So it is a challenge with the residents as well, because a lot of them come here and they come from the hospital where they've already been kind of isolated, and then they get here and they're isolated for another 14 days, and it's kind of hard on them. So that's a lot what I'm running into. I'm dealing with a lot of anxiety, emotional issues, isolation issues. Everybody, when they get here, they just want to go home. They don't want to be here. So, we're just dealing with that. I mean, thankfully, we haven't had any COVID positive patients in the last 2 months that I've been here. And so that's been good. But, just trying to get them to understand, what's going on. A lot of them don't understand, and because of, the guidelines, a lot of them are not able to take showers. That's an issue. They want to get their hair washed. So it's just, it's stressful, for them and for me, because it's like you're that person that they see, they can't see their family until they come off of isolation. So you're dealing also with the families too, because they're anxious. They want to see mom or dad or whoever, their loved one. So it's just a lot. So I have to deal with the patients and the families, and it's just a constant all day, I'm on the phone, I'm talking with the families, I'm in the rooms with the patients. So it's hard, and hopefully, soon it'll ease out, level out some, but right now it's difficult for the residents that's on isolation.
Well, thank you for trying to squeeze us in while you're working. I really appreciate that. Is there anything you would say to faculty about your education, things that really were important now to you that maybe you didn't think about then, or things that you think we should do different?
Well, I know because the pandemic started when I was in my last specialty. So it's like at first we were just all over the place. But after that session, everything started leveling out. So I did appreciate, just the instructors, taking out their time, because it was a change for everybody. Nobody had been through this. So, it was like, even though we were as students getting frustrated, we also had to understand that it was affecting everybody. But I did appreciate, the staff and their time and patience, of staying with us and, helping us at least get to our finish line, and so we were able to get to that finish line with a lot of support. And that was the most important thing, having that support, dealing with the technical difficulties that everybody had, so it was just, it was a time, but, I appreciated it, and we all made it out, and I'm happy for that.
We need you out there. Absolutely.
Thank
Well,
you.
my final question is the answer for each of you, just to say, in a couple of words, how you describe your feeling about the nursing profession at this point.
I feel so good to be able to be part of other support system and be that caregiver. And I do feel like I was educated and prepared for this. And I feel really good. I feel really good about the work I'm doing. And I look forward to having a long career and continuing to help change people's lives and help people through hard times.
Thanks, Cody. Bonnie, did you start to answer?
I was just gonna say, I would do it all over again. I really actually appreciate you guys. I think people don't really understand unless they've been there, but I appreciate the privilege of doing nursing through COVID. I think that the group of nurses that are represented in this panel, I think you guys are going to be nurses above and beyond the nurses that have come before us that have not been through a pandemic, because of the things that we talked about, the fact that we are much more clued in and using our community health knowledge and mental health assessment every day with all those patients. We've had an incredible, quick tutorial of how it all works together in one moment, because I believe under a pandemic that we've had, like you said, we've learned on the go, we've learned as we've gone through this, but I just don't, without the pandemic, we've never obviously, gone through school without it, or at least me, but I just see how that it's just given us a much bigger picture view of nursing.
Great,
So,
thanks, Bonnie.
yeah.
Benitra, did you have just a few words about your profession and being a nurse?
Yeah, now that I, am officially a nurse, I know there's nothing else that I would rather do or, want to be, because I am compassionate, and I have a love for the healthcare field. So I am appreciative, even though it's a crazy time that I became a nurse. I think this makes me appreciate it even the more, because if you can, get through this, you can pretty much get through anything. So I am grateful and I am thankful for this opportunity and experience.
Well said. If you could get through this, and 10 years from now, you'll be telling the new nurses about back in 2020. They'll look like they're really old, and they'll hopefully listen and learn from each.
Exactly. Yeah, this is the new norm.
It is the norm. Morgan?
I think it's actually very interesting seeing like their responses versus like kind of what I'm feeling more so because of working, I guess, as a nurse before COVID happened and how
Mhm.
great that was. And how it was a lot of the times it was more rewarding than directly working like through the pandemic, just being so like understaffed and not feeling like I can adequately take care of my patients. When they're going downhill. And then now it's slowly starting to get better, thankfully. But I don't think I would change anything. Even knowing that I was going to have to go through a pandemic, I still think I would have chose nursing. Maybe would have been a little bit more prepared for it if I had known ahead of time, but that's impossible.
Yeah, not possible, but thank
Yeah.
you. Nicole, Sharon?
I feel like I'm so incredibly grateful to have this profession. I feel like as nurses in general, this past year has really just emphasized how compassionate and how resilient we all are. I definitely feel like I've come out such a stronger nurse after this past year. And like Morgan said, like I wouldn't change anything.
Nicole?
I feel the same way. For me, I felt like it was I want to say it was an honor to work through the pandemic. Lightly, I want to say that. But, we prepared for so long, through all of our education to take care of people. And like, this was our fight or flight, and it was an honor to be able to like step up, really be a part of it. It was really nice because part of it, like the doctors were coming to us because we're with the patients. A lot of the hospitals, the doctors weren't even going into the COVID rooms. We were the doctor's eyes. Do we agree with that? No, but that's how it was. So it was nice to see that like we were being respected. We were being, considered in the actual plan of care. Would I do any other profession? No, absolutely not. This was like the big test, do we love it? Can we handle it? And if we get another test like this, come back and ask that question because I don't know. But for right now, this is absolutely where we belong for sure.
Well, I like that. The big test. And boy, has it been the big test for
Yeah.
sure. But thank you all. I'd like to open it up now to questions from our faculty.
We do have a question on the question and answer.
Yeah.
It was someone asked, and maybe Nicole or Taylor or Morgan would more so know this, but it says some nurses told me that the medical nursing director would support staff with emotional and spirituality moments. Did you experience that?
I don't think we did.
No, unfortunately, we didn't really see a lot of that. And in fact, some places we actually saw quite the opposite, where it was just, this is your job. You're here to do it. Go. So there wasn't a lot of support some places. I don't know if it really applies to this question, but I think one thing we saw that was it was hard to watch being a traveler is seeing the support that the staff nurses were receiving was like very minimal. I mean, these nurses they're there day and night, and they're not getting hazard pay. They're not getting extra support. The joke is pizza parties, but like they weren't even getting any of that. Some of these people, they're like when we went to Alabama, like their N95s were falling apart. They were never tested for anything. They were, nurses were coming to work sick because they were threatened that they had to be there, so it was really hard. It was really hard emotionally. Thankfully, our agency that we work for, they were very helpful if we needed anything, but from the actual facilities, we didn't see a whole lot of emotional support.
Well, here's an interesting question. How did you deal with the political and conspiracy aspect of the pandemic while you're taking care of sick people and watching them die, but then a large group of the population wasn't as concerned about it and weren't taking the precautions that that the science has told us are important. Anybody want to take that?
Well, oh, sorry. Well, I will say, as far as like the vaccine, since that's for me the most recent thing, I got vaccinated, and just catching so much flack that like I'm stupid and I'm gonna be barren, and I hope you didn't plan on having children, and they're putting in tracking devices into you, and having to take that, and it's even patients, you know, saying that like different things. It's very hard because we're sitting here risking our life every day for your health, and for you to undermine me and my choices to attempt to try and keep you healthy. Of course, myself, but also, would I have got it if I wasn't a nurse? Probably not. I just probably would have, but because I'm considering other people's health, I did it, and I did get sick from the vaccine for a couple of days. It was very uncomfortable, but it was a necessary thing I believe I needed to do. So that was been kind of hard and hurtful to deal with, but I'm like, I'm just going to do what I know is right. And I'm going to encourage you and educate you the best I can if you are open to it, and just let you know that's how vaccines work. And I am, which is something Chamberlain has you do in your last classes, is get basic vaccine certified. And I'm so grateful for that, because I am really educated when I speak to people. I know the 4 different types of vaccine reactions, and I can explain that to people and stuff like that. So it is very difficult, and you know, sometimes you can't argue with stupid, for lack of a better term. But I do just try and educate and use my education, and then at the end be like, well, I guess we just agreed to agree. You know, I gave you my facts that I know is facts, and if something else comes up, then you know, if I'm totally wrong at the end of the day, I'll admit it, but I don't think.
Well, and nurses, most trusted profession. And, you know, if they're going to listen to anybody, they're going to listen probably to a nurse that will help get them to have a better understanding. And, you know, at the end of the day, it's their choice. But I think to really share with them, and it goes back to what I said about all nurses being advocates for the health of all people. Morgan, you were going to say something, I think.
I was just going to say it was very hard for us to hear and see those things. All we can really do is try the best that we can to educate people, get their education, their medical education from Facebook and Instagram. So we would try to write posts about it with links that are reliable, instead of using things that we weren't for sure if they were reliable and things like that. It was hard. It was very hard.
Sure. We have a question, a live question, I think. Nope. Did we maybe already answer that?
Oh, yeah. Well, I see on here, it said, did you have patients that were dying that still thought COVID was a hoax? We had people taking their last breath, swearing they did not have COVID. Mm-hmm. What do? You can't argue with them. I mean, this is it. So we experienced that. Thankfully, not nearly as much as some people did, but we had patients, they swore, you know, up and down, I don't have the virus. They don't have the virus. And, you know, you just treat them. You just treat them the best you can.
There are a couple comments. I just want to make sure that you all hear them and see them. But one says from a faculty member, what a fantastic group and example of our nurse of the future colleagues. Very professional and very dedicated, and very proud of you all. So hopefully you feel that.
Thank you. I do feel, it's funny, Chamberlain uses the term extraordinary nurses, And I kind of always feel a little brag when I tell people where I graduated from, because they're like, you're awesome. We love having you on our team. I'm like, I'm an extraordinary nurse. So thank you to all the faculty that made me the nurse I am.
That's great. Thanks. Can you just talk a little bit about, you know, how you take care of yourselves and who provides you what provides you the most support during this period of time?
It's funny, we were talking about it right before the call, but I think a lot of us could agree that our animals, our support animals.
Understood.
We got lucky, we had each other. Traveling as like our little trio. There wasn't anyone more understanding than someone going through the exact same thing. So, you know, we all had really bad days. We just leaned on each other, living together, going to work together, everything 24/7. It took a toll on us as well, but like we had no one better experience than each other to just come home and most of the time just cry to each other.
Yeah. Well, Chamberlain just commissioned a study through Forrester, a research study, talking to nurses all over the country and nursing students as well. And the thing that came through loud and clear in our study and others as well is that the best support nurses got was really from other nurses. And I would think that that makes sense because, to your point, you can talk to a significant other, you can talk to a friend or your mom or whoever. They'll be empathetic, I'm sure, but they just don't understand it at the level that another nurse does.
Yeah.
One of the things, another thing that I just wanted to read, I'm so grateful for all of you, such bravery, especially as new nurses. I cannot imagine facing all of the things you had to as a new nurse. You all should be commended on your compassion, professionalism, resilience, and grit. You are extraordinary nurses, and we're so proud of you all. Again, just want you to hear that. And somebody referred to you as nurse warriors. So
That's wonderful.
And probably you felt like you had to put your armor on over your scrubs every day when you went in. Any other questions from the audience?
I'd love to ask a question, Karen.
Please, Karen.
Karen just referenced the study that we did, and there's a lot of talk and advice about self-care. And I would love you guys to talk a little bit about that. Is that something that can be taught? Is it something that what is your reaction when you hear, oh, you need to care for yourselves, or self-care is important to get through this? Is that something that you heeded or listened to, or talk about that for me, if you would?
I think and something that's really hard for me is when you're in nursing school, self-care time is like hard to find. So I think maybe like implementing that in some things, like coming in for a lecture, okay, this is our self-care day. Like, what are we going to do for this? Mental health days are so important, but in nursing school, you don't really have time to take mental health days. Being blessed to work, 3 to 4 days a week, we do have days off to take that time. But thinking back, I did a 12-month accelerated program. There really wasn't a thing called, mental health days or self-care days. So I think implementing that more in our education and drilling it home, that's super important. Make sure we're prioritizing our health and our mental health is really important, because I personally didn't experience that in my curriculum.
I would say, I'm sorry.
Go ahead.
I would say, so in our very first nursing class, introduction to nursing, they had this awesome thing where it showed you like the hourly calendar. We used different highlighters to color block time periods of like, I need to study, I need to do this. But also in my introduction to nursing class, they said color in you time. Like, make sure, is your color blocking your week off hourly, you're coloring, go get your toes done. Or, you know, and I will admit that I was in an accelerated program, but when I felt overwhelmed, one day I emailed my teacher, said, it's a mental health day for me. Let me know what I missed, because I needed it. I wasn't going to absorb anything. I was just burnt out and I needed it. And I hadn't missed any other classes. I was doing pretty well in the class. And I just emailed the teacher and I said, hey, I need a mental health day. I just need to sit and just mindlessly binge watch something or something like that, you know? And she was like, okay, I'll email you and let you know what you missed. It wasn't a big deal. I was being honest, I didn't make up anything. I needed a mental health day and I took it. And I probably absorbed more the remainder of that week and everything, because I took that one chunk of time for myself. Because had I went and sat in class or whatever online, it would have been pointless. You know, I would have just over my head. So sometimes, you know, if it's needed, the students need to take it. So I definitely agree with that.
Thanks, Cody.
And just to piggyback off of what they said, it is very important. However, I didn't know how important mental health days were until I was in nursing school and learning about, you know, all of, you know, the stress, you know, of the job or just everyday life. And like she, you know, the speaker was saying before, it's hard to do that when you're in nursing school. And then if you got a family, all of that, that's hard. It's hard to do, you know, have a mental health day because you have the school that you're worried about. You have your family when you go home from school. So it's like, how do you escape from all of that? But nursing school did teach me is you have to have self-care. You have to, because like Cody was saying, if you get overwhelmed, you go to class, you're not going to absorb anything. So it is very important to just take a moment, a few hours or a whole day to yourself, you know, and that should be implemented more in school because it is definitely needed.
Great. Thank you. I appreciate that. Just a couple of last comments from me. There was an invited editorial in Scientific American last week, and it was written by Eileen Sullivan Marks, who is the current president of the American Academy of Nursing, and it's titled "Nurses Are Also Scientists." And in that, she reminded me that when we talk about proning, which you know has been very important therapy for the patients with COVID, so turning them on their stomach, proning them at regular intervals, I was reminded that that was really invented by a nurse and a physician working together and working with patients with ARDS. And so I just want to again remind all of us as nurses the influence and power we have. And for faculty, I just hope you hear that what you do matters. It matters a lot. And little things that you probably wouldn't even remember you did, your students do. And it's so important that we work on preparing them for that communication and teamwork. And I want you to know, I didn't plant community health in any of them to say that, but it really, community health does make a difference. So, so thank you to all of you for participating today. Really appreciate it. And thank you for all that you're doing. And wishing everyone a happy Nurses Week and month. Thanks so much.
Thank you.
Thank you, everybody.
Bye.
Bye.
Bye.